Okay. All right. Again, the gonads, the testes, the ovaries, gametes, yes, and the fertilized egg is called zygote, yes. Okay. Anytime the ova and the sperm get together, yes, you have a zygote, right? That is a new and unique individual. You have chromosomes from mom, you have chromosomes from dad, right? Did you get some really good features from your mom and from your dad? Did you get some bad stuff from your folks too? Yes, unfortunately. Right? Yes? Okay. Righty. We're going to talk about the male today and probably the female tomorrow, right? Yes? The male's testes are kept in the scrotum, yes. There's a septum down the middle of the scrotum, right? There's a septum down the middle of the heart. There's a septum down the middle of the nose, right? That keeps one testicle over here and one testicle over here so they don't get messed up, twisted, right? Yes. Sometimes one of them gets twisted and that's way bad. But anyway, yes. Okay. Sperm is delivered to the exterior of the body through a series of ducts or tubes. Okay, here we go. Testicles shaped like that. It's about 1 inch by 1.5 inches. Okay. On the back of the testicle here, you have a structure called the epididymis, E-P-I-D-I-D-Y-M-U-S, epididymis. And the epididymis is where immature sperm is stored, okay, from the epididymis, right? You have cells here. You have tubules called seminiferous tubules, right? And those produce the sperm. You also have Leydig, L-E-Y-D-I-G. That's got to be somebody's name, an eponym. Leydig cells, and they produce androgens, A-N-D-R-O-G-E-N-S. Androgens. Androgens are male hormones, okay? Androgens are male hormones, okay? Testosterone being the main one, okay? Right? Now, in the male, the scrotum is outside the body. In the female, the ovaries sit right here, way down low, where the pelvis comes together. Ladies don't realize it. They think they're up here, maybe because they get menstrual cramps. No, they're way down here, right here. When I learned to x-ray, we put a lead apron to cover the ovaries and the testicles. In the men, we hung it down to cover their testicles. In the female, we hung it higher, right here and here. Most of the time, ladies think they're up here because sometimes they get cramps up there. No, it's not. They're down low in the pelvis, okay? Right? Okay. Now, why is that? Why is the male testicles outside the body? Because sperm is very sensitive to heat, and our core temperature about 37, 96.5, right? And it's too hot. They don't like it, right? So down in the scrotum, it's instead of 37, it's about 34, several degrees lighter. Oh, by the way, if you and your husband want to have a baby, keep him out of the hot tub. Because if he goes in the hot tub every night, it gets hot, 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 and that water is what it does to his sperm. Okay? Not a good thing. But anyway, right? Forgot. There's a tube right here. And that tube is called the vas deferens or the ductus, D-U-C-T-U-S, ductus, D-E-F-E-R-E-N-S, ductus deferens, right? The term that I was taught is vas deferens, okay? Right? Hence the word vasectomy, which we'll talk about in just a little bit, the vas deferens, right? Okay? So out of the epididymis, through the vas deferens, into the abdominal cavity, and then out through the urethra in the men. Okay? Okay, we talked about seminiferous tubules that make the sperm. We talked about Leydig cells, right? Sperm called semen, seminiferous. Makes sense, right? Now, oh, by the way, this epididymis, right? Sometimes in young men, I guess it could happen to old men too, but anyway, sometimes in young men, that gets inflamed and irritated, right? And they start having pain in their testicles. It's a very common condition. Happened to one of my boys. I had to take him to the PA Bruce and give him ran to antibiotics and kill the germs, and was fine after that. But anyway, can cause orchitis if it's not treated, meaning inflammation of the testicle. Okay? Now, one of the most common cancers in young men is testicular cancer. It's about 1 in 50K, right? About 1 in 50,000 men will get it, right? And what it is generally they will feel a lump will develop somewhere on their testicle, okay? Right? Yes? Now, ladies, you need to teach your little boys when they take a shower to make sure and feel those testicles to make sure they don't have no lump, okay? Because it's generally painless. It's generally painless, and caught early, the treatment is much better, right? Yes. Most common cancer among young men, 15 to 35, okay? Now, treatment is very effective. They will use medications, or commonly they will cut it out, right? And the young man will just have one testicle, but you can have a normal life, you can have normal sex. One of my patients, 50 years old, had this, and I'm like, wow, dude, you're way too old for that. He's like, yeah, I know, that's what the doctor told me. But he said, had one of his testicles taken out, and working fine, said I can still have sex, It's just I'll have one testicle instead of two now, right? Now, what is a risk factor for this? What is a risk factor? What is that? Okay? I shouldn't say why is that. I should say what is it associated with, okay? Can't really say it's the cause of it, but anyway, let's explain just a little bit here about this, okay? Right? Right? Okay. Here's a man's pelvis. Here's his kidneys, right? Here's his scrotum and his penis, okay? Before he's born, guess where the testicles develop? Testicles develop about right there. And there's an artery and a vein to them. And guess what happens right before, or soon before he's born? The testicles drop down along with the artery and vein into the scrotum, okay? And that is why before your baby, your little boy goes out of the hospital, after being born, what are they doing? They're squeezing on his scrotum to make sure his testicles descended. If they don't, that is called crypt, C-R-Y-P-T, crypt, or cryptorchidism, okay? What does crypt mean? Tales from the crypt, right? Secret or hidden, yes, okay? Cryptorchidism, yes, that is non-descent of the testes. Non-descent of the testes. Oh, by the way, years ago when they couldn't treat this and they didn't know what to do, guess what? The testicles stayed up here. They did not form properly, and you were probably sterile. Okay? Could not have children, right? Because the testicles weren't down here where they're supposed to be. Yes? And it's too hot up here. That's why they're out there. Okay? Oh, by the way, where they go down through here, there's a ring, inguinal ring, internal and external. Yes? And the big deal about that is, I was watching another video today about inguinal hernias, right? We talked about that. You get the hernia right there and right there, right? And that's called direct. I have those from lifting heavy things. About 1 in 4 men get that. because there's a hole in that wall, abdominal wall, and because the hole, and every time you lift something, guess what? It puts pressure on the hole, right? So the small intestine can poke out, yes, right? And me in my profession, yes. Man, sometimes I have guys in there 300 pounds, and I'm 160, right? And I'm pushing on 300-pound guys. Right? Some days I come home from work walking like this, and I say, "What happened to you?" Because I wrestled a 300-pound man and he won. Yes. But anyway, see, certain professions. If you're a cement mixer and you lift sacks of cement all day long, or a brick mason, right? My friend Curtis Zambrano lifting bricks, right? Then, or any longshoreman lifting heavy sacks, anything, it can do that. It's very common, 1 in 4 men, and of course, it'll cause the men, they have a lump there and there, and some fat, and that intestine will want to push out, right? Yes. Mine's bigger right over here than it is this one over here, and such. And yes, and what happens is it can also go through the inguinal ring into the testicle, and your small intestine will go down into your testicle. That's why when they check a man for a hernia, okay, drop your pants, stick the finger up the inguinal canal right next to the cough. When you cough, you do a Valsalva maneuver. You increase all this pressure, and you'll feel it. I was taught you feel it on the end of your finger, right? Unless it's a big fat guy, right? Or something. I'm sorry, that's not politically correct. But anyway, yes. And so then they do screening, right? If it's a bulge here, like here and here, you can see mine. This one's about that big, almost as big as a goose egg, and that one's smaller, right? And 4.5 more years to Medicare, baby, and I'll have that fixed, right? But anyway, yes. And so, anyway, that's another thing. Non-descent of the testes, and then you got to really worry about testicular cancer, and the other thing is the inguinal hernia there, right? Okay. Oh, by the way, much less, it'll go down here in the femoral. Down here, you have hernias here. But anyway, okay? Okay, right? If they take the testicle out, there's about a 90% cure rate. Yes? Okay, we just talked about that. Hernia and spermatic cord, right? Okay? Right? And again, testicles are here, and vas deferens comes up, around, and hooks up to the ejaculatory duct and out the urethra. Okay? Now, next term, perineum. P-E-R-I-N-E-U-M, right? Perineum, yes, right? Peri means around. Basically, between your legs, that kind of diamond-shaped area with the anus in the middle, that's your perineum, okay? That's your perineum, okay? All right. Yes. Did we talk about everything? I think so. Okay. Okay, let me erase a little bit here. All right. Yes. Oh, by the way, if you have an inguinal hernia, what can happen is, it's kind of rare, but it can, as your small intestine comes out, it gets twisted and it blocks the intestine, right? And that's way bad, that's emergency situation. And it also can twist and cut off the blood supply, and that also is a surgical emergency, right? Okay, so it doesn't happen very often, right? But it doesn't happen very often, but it can happen, and that's a surgical emergency. Usually when you get the hernia, you see the lump. If you lift something heavy, you feel the burn across there, or sometimes if you take a big step or such and pull that area, stretch that area, then yeah, no fun. Okay? Okay. All right. The male copulatory organ is the penis, right? Yes. Okay. The penis and the scrotum make up the external genitalia, The end of the penis is called the glans penis, Glans, the glans penis, urethral opening there. Yes. Okay. Now, let me explain. Next, right? The skin of the penis is very loose, right? Because men get erections, yes. And so in this country, about 60% of the males, the rest of the world only about 15%. It's common, this skin hangs down and will almost cover the opening, yes. And this loose skin around here, of course, is called the prepuce, Prepuce, or the biblical term is foreskin, right? And so in America, about 60% of the people, of the boys, they cut the foreskin off, they pull it back, they put a little, well, when I've seen it done, they had a little plastic thing like this, shaped like that, and it had string hanging from it. Pull the foreskin back, stick it on the glans penis, pull the foreskin forward around it, wrap the string around it, and well, the baby screamed too, yes. Yes, years ago they didn't give me any anesthesia, right? Yes, and such. Now, and when you circumcise the child, right? If he's circumcised, he'll have that dark scar at the back of the glans penis here, right? The end of the penis. You'll have that dark green, yes? And he'll have a distinct contour, yes? Now, guys that are not circumcised, the foreskin will just hang down and it will become tight when they get an erection, right? Yes? Now, my feeling is that's a religious thing. Jewish people do that, and so and such. Medical reasons, there's really no medical reason to do it. Although they do claim that you're less likely to get HIV and this and that if you're circumcised. I guess that's important if your child is a homosexual. But anyway, other than that, I did not have surgery on my boys. I felt it was unnecessary surgery, right? Was my feeling, and I'm not Jewish. But if you're Jewish, yes, that's important. I understand that. I get that, right? But anyway, very common. And again, much higher rates here in the U.S. than much higher in the U.S. than in the rest of the world. Okay, right? Okay, ladies, if the child is not circumcised too, yes, right? You got to teach the kid to wash himself. Yes, you got to teach the kid to wash himself, because if the foreskin hangs down, right? Yes. What's the warmest place on a man's body? There, right? Yes. So it's dark, it's warm, it's moist, and that skin kind of wraps down and around like that. Yes. So germs can grow there. So you got to teach him to pull that back and wash it when he's a little boy. Okay? Yes. Okay. Okay. The vas deferens or the ductus deferens, as we already talked about epididymitis, right? Where the epididymis gets infected. Yes. They don't know how that caused to. No idea what causes that a young feller to get that. But anyway, okay. Let's talk about the vas deferens. Okay, the vas deferens, right? Talked about septum down the middle, epididymis, and the tube comes off the vas deferens up into the abdomen, leaps around, comes around to the ejaculatory duct, into the urethra, the penis on the man, okay? Again, it's about 18 inches long, right? So, it's a ways. Now, the most common procedure for sterilization for men, or the easiest, I should say, or the easiest sterilization procedure is men, they shave them, they make a little cut right where the scrotum attaches onto the body, up under there, yes. They take out their grandmother's knitting needle and they hook it, right? And they pull it outside your body through that little bitty slit. And then they used to tie it with string. Now what they do is they put metal clips over here and clamp them down. And then they cut about 1/4 of an inch out of the tube. Ask me how I know, right? Okay? And so that's what they do. It's about 99% effective, okay? But the doctor always asks you, oh, how long you been married? Oh, how many kids you got, right? Because he doesn't want to do that to someone that is not real sure, right? When I had it, both of my boys were like 12 and 14. Did not want any more kids, no late surprises, right? And such. And anyway, now, what happens, very rarely, 1 in 100, yes, is that you get what's called recanalization, right? Yes, those two little tubes, guess what they do? They hook back together and it doesn't work. After the surgery, you have to go a couple of times and give a sample, and they check it to make sure that there's no viable sperm, right? Yes, yes. But in cases of recanalization, those two little tubes get back together and it doesn't go down. Yes, right? When they do the surgery, they think, oh, it's simple, oh, it's minor, it's no big deal. And then you're laying there on your back and they give you this shot and they go, okay, this is where you feel like you got kicked by a mule. And I swear the guy goes like this, wham, kicks you as hard as he can right in the groin because it hurt bad. But anyway, for about 30 seconds, yes. Then I was numb, then he did the surgery, yes. Now, guess what? Yes, it's 99% effective, but there's always a 1 in 100. And guess what? It didn't work. Proving once again, you can't keep a good man down, right? Yes? So, then he wanted to do it again. I said, oh, no, sorry, you kicked me in the groin once, I'm not letting you do it again. No. But anyway, so, but that's the way it is. It's actually a very simple surgery. They hook it with a knitting needle, they pull it out, it's white, looks like a white tube, and they put the clamp over here, and they put the clamp over here, and then they cut this 1/4 inch section out, so you have the two ends are not hooked together, and they shove it back in with their knitting needle. And it's very simple, right? Right? It took me a while. I could learn how to do that in an hour easily, right? Watch one, watch one. My friend the surgeon told me that. Oh yeah, that's what they teach you. Watch one, watch one. No, but anyway, yeah. Okay? Cutting the vas is called vasectomy because you're cutting the vas deferens, right? Okay? Now, here's the problem. It's only about 50% reversible because unfortunately in our society, guess what happens? People get divorced, right? And with men especially, what do they usually do? They get married again, right? And they get married again usually to a younger woman who wants to have kids, right? So you got to have kids with this gal too, yes? So it's about 50% effective, putting the two tubes back together, cutting it out, and sewing it back together. You got about a 50-50 chance, right? I've had patients talk to me about this. Well, I've had it twice. They tried to put it back together. But anyway, right? So, yes. Okay. All right. Now, let's talk about the urethra. Okay? Okay? The urethra, right, from the bladder, out of the body, yes. The tube, from the penis, the urethra, okay? If it gets infected or inflamed, I guess I should have drawn it out there. Right? You got urethritis, okay? Germs, okay? Again, that's why after sex it's a very good idea to go urinate to try to wash those germs out, okay? Okay. If we, I'm not very good at my art, so let's see. Seminal vesicles, okay? As the vas deferens comes through the pelvis, you have your seminal vesicle, you have your prostate, and the seminal vesicle produces some fluid. The word semen, that's, I'm sure it's the root seminal vesicle, right? About 70% of the fluid, right, of the seminal fluid is from the seminal vesicle. It then goes through the man's prostate and out through the urethra. Okay. Now, here's the thing about the fluid from the seminal vesicles, right? It helps the cops solve crimes because they have a special light, a fluorescent light, and like if they, I'm going to say it, a lady that was had a crime, maybe she was murdered, they always take her clothes and put the light on her clothes, especially her undergarments, because if there's semen on them, they will light up and they will know. That's a pretty good indication you ladies know what happened, right? Okay, so that helps the cops to see if there's any semen there, okay, right? The fluid is yellowish, viscous, meaning, thick, and alkaline, right? Oh, by the way, it's alkaline. Why would it be alkaline? Because the lining of the vagina is acidic, right? We talked about that. It's acidic, yes, right? Okay. The fluid contains fructose, fruit sugar, right, and citric acid, and coagulating enzymes. Why would it do that? Okay, because the sperm is deposited in the vagina, it sticks to the inside, right? And then later it'll break out and make its way up through the lady's plumbing that we'll talk about tomorrow. Okay? Okay. Right? Now, let's talk about one of the most common problems that older men have, the prostate. Okay? Let's talk about the prostate. The prostate also contributes, maybe about 30% of the ejaculate. Okay? And the prostate is shaped like, well, I'm going to draw a nice picture. Right? Here we go. The prostate is basically shaped like a donut with a hole in the urethra comes through it, and then, of course, out the penis. And what happens is, it's about as big as a walnut nut when you're a young man, and as time goes by, it grows. It gets bigger, 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 right? And because it grows, it squeezes on the urethra, right? And what happens to older men is that, oh, by the way, when you're 50 years old, about 50% of the men have trouble with this. When you're 60 years old, about 60% of the men have trouble with this. When you're 70 years old, about 70% of the men have trouble with this. When you're 80 years, I won't go there, but anyway, right? Okay? It's very common. And what happens is when men are urinating, trying to empty their bladder, right? When a man's young, he'll pee like a Russian racehorse. I mean, just, right? But when he gets older, he has no pressure because that urethra is getting squeezed on. And that's why, too, I was traveling, where were we? Somewhere in Europe, I can't remember. And one of our friends, an older man, about 15 years older than me, and this and that, and one of the young guys goes, "Oh man, John, you got to try this coffee. It's amazing, this and that." And he said, "No, if I drink that cup of coffee," he said, "I'll have to go pee twice," right? Because he had trouble emptying the bladder all the way, okay? Right? Now, as that grows over the year, that's called benign, B-E-N-I-G-N, prostatic, P-R-O-S-T-A-T-I-C, hypertrophy, H-Y-P-E-R-T-R-O-P-H-Y, BHP, right? BHP. It's going to happen to all men if they live long enough, okay? Now, what is the treatment for that? First, they try some drugs. They have some drugs, one called Flomax, but the most common one is finasteride, Finasteride. Finasteride, it's also AKA Propecia, right? And the whole thing about finasteride is when you're using it to treat BHP, right? It really lowers a man's free testosterone, okay? Now, they also use finasteride, the slang is they call it fin. They also use finasteride too they give it at a very low dosage because what happens is testosterone is converted into dehydroxytestosterone, right? And there's an enzyme called 5-alpha reductase, right? And so DHT, dehydroxytestosterone, is associated with male pattern baldness, like I got right up there, okay? And so what happens is finasteride, guess what it does? Inactivates that or breaks that down. And so you have less development of DHT, right? Now, male pattern baldness is basically, for the most part, it's inherited, right, in the genes and such. Now, if you're already bald and you go on finasteride, is that going to help? No, it's not going to help a lick because you already lost your hair, right? So, if you start losing your hair in your late 30s and your 40s and you want to go there, then you need to get it then because once it's gone and out, boom, right? It helps to prevent the loss of hair, okay? Now, the other one is minoxidil. Minoxidil, right? Rogaine, right? And this is a topical. They can give it orally. Minoxidil is a blood pressure medicine, and the guys that they gave it to, some of them, they developed more hair all over their body, and they discovered that's a side effect. That's a side effect of minoxidil, right? So minoxidil, it's like, I liken it to fertilizer. You put it on your bald spot and you rub it around, and it keeps the hair goes through different stages, anagen, telogen, forget the third one, and it falls out, and then it comes back 3 months later, unless you have the genes for it, right? And it's a stimulant. It helps the hair be thicker. And another thing, as we get older, our hair gets skinnier, and that's part of the reason that it looks thinner, right? And such. Have you seen the guy? He's all bald, but the hair he does have is tiny little peach fuzz, baby. Yeah, that's why. Okay. But anyway, minoxidil or Rogaine. They have started giving it at a very low dosage orally, so you don't have to put it on your head, rub it on the back of your head, right? But anyway, and again, this is a stimulant. This helps too, right? If you want to treat hair loss, the best thing to do is, number one, you got to treat it before it gets bad when it's first starting, and number two, you use a combination of these, right? Yes. Now, I don't think I would take finasteride. Just my feeling, because I would never take that because it lowers free testosterone, and as men get older, right? Guess what happens to their testosterone? Way down, right? Yes. And so I'm not interested in lowering my testosterone, right? I don't have trouble with that. I rub that on my bald spot regularly and such. But anyway, to try and stimulate it and keep my hair from shrinking. But like I said, if you wait till it's all gone and you bald as a cue ball, just forget it. It's not going to help. Okay? So there are some people that claim they have major side effects from this. I don't know, because the dosage is so low. when they give it to an older man for prostate, it's way higher. But anyway, I don't know how I got off on that. Okay? Prostate cancer is second most common cancer of men. Okay, but let's talk about it. There's two forms of, I shouldn't say two forms. There are two presentations, right? Now, if men live long enough, they're probably going to get prostate cancer too, but here's the thing. There's one form of aggressive prostate cancer that attacks men in their 40s and 50s. It's deadly. It will metastasize to their bones, to their brain, to their lungs, and it's just a killer, right? However, most men have been diagnosed with prostate cancer. It is very low grade. It is not the aggressive type. And so years ago, oh, you got prostate cancer? Cut it out, cut it out. Well, the problem is in this bottom medial lobe here, that's the nerve to the penis. So when you cut that transurethral resection, TUR, TURP, I forget what the P stands for, but anyway, when you cut that out, guess what? No sex for you, buddy, right? That's what happens, and that's why a lot of men would not want to have that surgery, yes? Now, what they're doing nowadays is a couple of things. Very interesting. There's a procedure where they use radio waves, and they stick a little probe up the urethra, and the radio waves destroys part of the prostate. There's another one called Resume, right? They stick a probe up there, and the probe is shaped like this, right? It has a hole in it, and guess what they do? Steam, hot steam, right? Out through the end of it, yes? And they do that around here, right? And that kills some of the cells, and that is common for, that's supposed to be a good procedure. And it's like they do it in the office. It takes 15 or 20 minutes. You're at the doctor's office for an hour and a half, and you get to go home. Okay? And such, the Resume procedure. Now, the latest is called water aquablation. And they stick a probe. They stick an ultrasound probe in the anus, and then they make an ultrasound of this prostate, and a computer measures it, and this and that. And what they do is they stick the probe through the urethra then, and they use water, and they make passes back and forth in high pressure water, and there's no heat, right? And basically what they do is destroy this prostate tissue and then suck it out, right? It's called water ablation, right? And oh, by the way, most men, the nerve down here, yes, they stay away from that. So the chance of being impotent after that is much lower, right? Almost any prostate surgery too, there's another side effect, and that is retrograde ejaculation. And what in the heck does it? Retro means back behind, right? So when the man orgasms, instead of the sperm coming out, it goes backwards into the bladder. Okay, it's called retrograde. So he doesn't have ejaculate. Or he does, but it doesn't come out. Anyway, so, but this water ablation, one of my friends, again, 10, 12 years older than me, he just had this and such. The Resume is best used on a very smaller prostate. This can be used on a bigger one, but not a humongous one. And anyway, notice the outer lining of the prostate. Think of an orange, the skin of an orange. So the outer part, right, is not affected. It's this inner part that squeezes on that. And the redo rate, where they have to go back in there and do another surgery, is very small. And someday I'll probably have to have that water ablation. And I guess that's kind of, because I do a lot of research for it. That's my cut on me, I guarantee you. Right? A lot of research, yes. And anyway, but that's if you have to have surgery for benign prostate. Now let's talk about prostate cancer. Prostate cancer occurs generally on the outer part, right? They will do a biopsy and stick needles in here and pull it out and look at it, and they give you a score. And the score is, I guess it was Dr. Gleason. They give you a Gleason score, 1, 2, 3, 4, 5, 6, 7. You're getting moderate. If you get 8, 9, 10, that's much more severe. And the thing is, most prostate cancers are what's called indolent, D-O-L-E-N-T. Does anybody know what that means, indolent? Okay. Indolent means this. You're lazy, you're no good, you don't do anything, you are worthless, right? Okay? So, these indolent cancers, meaning they're very slow growing, they don't spread anywhere, and if you find a guy, he's 75 years old, he's probably going to die of something else. So now with the prostate cancer, unless his Gleason score is very high, he has the aggressive type, many times they do watchful waiting, okay? The maxim of the medical doctors is first do no harm, right? And many times doing the, oh yeah, you got prostate cancer, give him a turf, man, right? The cure was worse than the disease, and especially if he's 80 years old, he's going to die of heart disease or something else before he dies of that prostate cancer that's very slow growing. So many times they go for watchful waiting. Okay, my brother, 12 years older than me, when he was about 62, then he was diagnosed with a prostate cancer, and he's cut it out. So they cut him out. So he has a lifetime prescription of Viagra. But anyway, right? But I'm not big on surgery when it's not necessary, especially when I almost think of this like wrinkles. If you live long enough, you're going to get wrinkles, right? If you're a woman and you live to be 100 years old, there's about a 99% chance you're going to get breast cancer, but it's probably going to be the slow-growing type, much later in life, not the aggressive young type, right? But anyway, so over the last 15 years, they've really totally radically changed the way they treat prostate cancer, right? Because so many of them, they're not going to die of it. They're already old, so just watch it, okay? Right? Yes. Okay. Screening, yes, right? 2 fingers up the anus, the glove treatment, yes. And the top of the prostate, when you go in that way, is shaped like this, and basically you're feeling for lumps. Well, folks, by the time you got a big lump on there, it's way late in the game, right? So they do the PSA, prostate-specific antigen, a protein in the blood, and I'm not a big fan of that because I don't think it's very accurate, and if you're training really hard and you're riding your bike really hard, you're going to be in a 100-mile bike race, guess what? You're putting a lot of pressure down there and your PSA is going to be high, right? So it's not specific, but anyway, I don't think, okay? Okay. All right, semen. Sperm, testicular fluid, and the accessory gland secretions. You have another gland down there called bulbourethral. You need to look at the picture in the book. I can't draw a nice picture of those, but anyway, okay? And such, okay? Sperm, testicular fluid, accessory gland, meaning also the fluid from the prostate and the seminal vesicles and the bulbourethral glands, okay? Right? And clotting factors, again, so the semen will coagulate and stick to the lining of the vagina, and that way it keeps it from coming out, okay? And such, right? Normally, ejaculate is about 2 to 5 mils, and only about 10% of the ejaculate is sperm, okay? But sperm accounts for 20 to about 150 million sperm, right? In one ejaculation, okay? It's a bunch, ladies, it's a bunch. 150 million up to, right? Now, They say over the last 70 or 80 years, men's sperm count has been getting lower, 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 and they don't know why. One of the theories that I have is that nowadays, and I told you my older brother had prostate cancer, and he's like, oh, you need to check on. Number one, it doesn't run in my family. Number two, we have totally different lifestyles, right? Because I'm trim and I've been exercising for 35 years, and he spent his whole life being 100 pounds overweight. And guess what? All that fat. People don't realize fat is an organ too. And guess what fat makes? Estrogen. What's estrogen associated to with in men? Big gut. Your husband has low T. They have all these centers. Go get checked for T. Low T, right? Yes, right? You want to raise his testosterone? Yes, get his fanny off the couch. Make him exercise, make him lose weight. His testosterone will go up, right? He'll lose weight, he'll feel better about himself, and he'll be more sexy. Yes, right? Okay, right? And part of it, I'm sure, is psychological. But I have never been checked because I'm not concerned, because I have a totally different lifestyle than my brother, right? And my son got married last year, and we were all together. And I'm telling you, I can't believe it. He's 12 years older than me, and he's just like walking around like a little old man, And my younger brother, 4 years younger than me, said, well, I look to you, David, to see what it's going to be like when I get older. I'm like, by God, I'm not going to be like that when I'm his age. No way. Look at me, look at him. There's no way. Anyway, right? I hope that you understand by the end of this course, a lot of your health, it just depends on you, on what you do, and what you eat, and how you exercise, and how you live your life. It's your lifestyle, right? It's your lifestyle, right? So, that's real simple. But anyway, okay? Okay. Here we go. Here we go. Okay. If we make a cross section this way, right, through a man's penis, he has two corpus cavernous, C-O-R-P-U-S, cavernosa, corpus cavernosa, right? And the other one is the corpus spongiosum, right? Urethra down the middle there, yes? These are three chambers, and what happens is this. Under proper stimulation, right, blood will flow to that area. When blood flows to that area, you get an increase in nitric oxide, vasodilation, and these chambers fill with blood. And when the chambers get large, filled with blood, then they squeeze off the veins, and the man gets an erection. Okay? Right? Now, parasympathetic, right? Remember we said feed, breed, right? Parasympathetic, calm, relax, rest, and digest, right? Now, here's the thing. That's what causes a man to get an erection, parasympathetic nerve supply. Yes? Now, we talked a lot about the balance between the parasympathetic and the sympathetic, right? And this is an area where they work together, because to get an erection, you got to have parasympathetic. What does that mean? That means men, if they're really stressed out, they have trouble getting an erection, right? But once they got one, when it's time for orgasm, guess what? Orgasm is sympathetic stimulation, right? Right? That comes from about L1, L2, about right along up in here, higher than you would think, okay? That's orgasm. That's erection. Okay? Okay? Okay. Enlargement of the erectile bodies with blood caused by nitric oxide. Yes? What does Viagra and all those medications cause? Right? More nitric oxide, more blood flows into this area, and gets an erection. Yes? Now, after a man has an orgasm, right, there's a refractory period where you can have sex again, right? When you're young, maybe it's 30 or 40 minutes. When you get way old, maybe it's the next day, right? Ladies, you know, can as much as they want to, as long as they want to, or as many hours as they want to. Men can't do that, right? Because the refractory period, okay? Now, erectile dysfunction, inability to attain an erection, okay? The parasympathetic nerves, they don't release enough nitric oxide, right? Men, right? Think about this, ladies. Smoking, right? Clogs your arteries. Everybody knows it clogs arteries in the heart. Guess what? Clogs arteries all over your body. Guess where it clogs arteries? On man. Yes? So, if I get a young guy in my office, I talk to him a little bit, and I say, oh, by the way, you know smoking clogs your arteries. Yeah. And true story, my friend Jacob, he married my climbing partner Kurt's daughter, right? Mercy. And we're out in the barn climbing on the wall. He was belaying me. And he was a smoker, 21 years old. And his dad in his 40s had a heart attack, in his mid-50s had a heart attack. He just ran his family big time, right? And so I talked to him a little bit. I said, you know, your dad had a heart attack, very young couple. Yeah, I know. You know, smoking's clogging those arteries, right? Yeah. Well, let me tell you, it's clogging some other arteries you don't want to clog. And I said, you just got married and you got a gorgeous wife. And when you're my age, guess what's going to happen to you, right? You're not going to be able to do anything about it because you clog those arteries, sir. That's what's going to happen to you, right? So you can talk about it, you can think about it, but you're not going to be able to do it, right? Yeah. Took about 3 weeks. He quit smoking. That's been 15 years ago. He's never smoked again, right? So the young guy. Now, if it's an older guy, nothing I say is going to make an older guy quit smoking, right? But if it's a real young guy, they might be motivated, yes. So I tell them that. Oh, by the way, you know where you're clogging the arteries? What arteries you're clogging? Yes, right? And such. But anyway, so 50% of American men over age 40 have some degree of ED, okay? 50% of men over age 40. Is that not astounding? Half of the men, by the time they're 40 years old, have some degree of that, okay? There's a lot of causes, okay? Number one, psychological. Sometimes men, right, have difficulty getting an erection. Then they will be afraid the next time and afraid the next time, right? So there are some psychological reasons for that, yes. What about smoking? You clog those arteries, that's a big reason, yes. Now, alcohol, right? The commercials, they try to make it look sexy. It's not. It depresses your sexual response, right? It's just the opposite, okay? Right? Very commonly drugs. Very commonly blood pressure drugs, okay? And also too, the antidepressants, right? Many times the antidepressant drugs will give a man trouble in that area, okay? Now, it's very common too, men that are older, right? You know? Last weekend I climbed the mountain, I spent 9 hours sweating, sucking wind. I came home, I drove 9 hours home, exhausted, came in, took a shower, cleaned up. It's 11:30 at night, right? And my wife knows she don't got to worry, right? Because that boy's tired. Yes? Yes? So, older men when they get tired. So don't make them wait till after midnight. That's cruel. Don't make them wait. Yeah. Sorry. But anyway, chronic ED2, hormones, right? What hormones are we talking about? Insulin. Yes? Insulin. Why? Type 2 diabetes. Yes? Remember? Type 2 diabetes, you have high insulin, high insulin, high insulin. Yes, right? And then, when the pancreas can't work anymore and can't produce enough insulin, guess what? Blood sugar rises, you get, talked about the very first, glycation, right? Clog those arteries, yes. Not good, yes. Arteriosclerosis, yes. You can also get varicose veins down there. Remember, varicose veins are where the veins dilate, they get big, they get tortuous. In fact, my brother, the one I was telling you about, he was big and fat, and it's very common men get what's called a varicocele, which is a vein in their testicle, or close to their in their scrotum, I should say, close to their testicle, that swells up and gets real big, and he had to have surgery to have to take it out because it was causing a problem. Okay? From a whole bunch of weight here, putting pressure down there. Okay? The nervous system, if you have a stroke, it can cause problems, right? Now, this was big about the late 80s. There were some cyclists that they claimed had trouble, and they were pro cyclists because they're riding the bike all the time, thousands of miles a year, and they got pressure on the perineum down there and rubbing on the pudendal nerve, see? So, supposedly some guys, I don't know if that's very common, but anyway. Multiple sclerosis, much more common in women, but in men it can cause that. And we already talked about varicose veins. Okay? Okay. Right? Yes? Ladies, a word to the wise too. If your husband has trouble getting an erection, don't ever, ever, ever make fun of him or make light of that, because unless you want a divorce, okay? Because you're really going to damage him psychologically, I'm just saying, right? So you're just going to damage him psychologically, and it's not going to be good for your marriage, believe me, right? So, okay. Okay. Change of subject. We got to talk about mitosis and meiosis, right? Yes. Let's talk about that. Okay. Right? Yes, now they got all these things on the internet now where men can go on the internet and fill out a questionnaire, and a doctor looks at it, and then he will give them Viagra and this and that. They don't even have to go to the doctor, right? They don't even have to go to the doctor and such. It comes in the mail in an unmarked envelope, I guess. That's what I've heard. That's what I've heard. I don't know. I'm still fit, and I haven't clogged my arteries, so I don't have trouble that way. But I know a lot of men, by the time they're my age, they got the big gut, and they're not fit. Their testosterone is low, and they do have trouble. But anyway, hey, let's talk about, remember, we already talked about mitosis, right? Mitosis, remember, you got interphase, you got prophase, right? You got metaphase, you got anaphase, and you got telophase, right? Yes? And interphase, in between mitotic cycles, right? Prophase, remember, the genes are rolling up. Metaphase, they come to the middle. Remember, meta for middle, right? Yes. Anaphase, they pull apart and such. They were at the middle, and then they start pulling apart, right? And then telophase is where, right, you get the cleavage furrowed, right? And you end up with two daughter cells, right? Okay? But now, let's talk about those chromosomes, right? You have 23 pairs, right? You ever heard of the deal? 23andMe, right? Yes, that's where that comes from, right? 46 singles, right? Or 23 pairs, yes? Now, when you have 23 pairs or 46 singles, whatever you want to say, that situation is called diploid, D-I-P-L-O-I-D. And in the literature, they say 2N. Okay? Now, here's the thing. Here's the thing, right? You have one cell, and boom, boom, you got 2 daughter cells, right? Yes? And this has got 23 pairs, or 46. This has got 23 pairs, and this has got 23 pairs, right? And those are somatic cells, body cells, right? But here's the thing. Here's the thing. That's somatic cells we're talking about, right? That's not gametes. Because gametes are different. Because if I donated 46 chromosomes, and my wife donated 46 chromosomes, right? The kid doesn't have 46 chromosomes. He would have, what, 92? I need Joseph to do the math. But anyway, I need 92, right? Yes, 46 times 2, 6 and 2 is 12. 92, yes, right? Okay. So what happens is mitosis carries on, and the simplest way I can explain it is, it's just another step. It's another division, okay? So you go from here to here to here, right? Now, these are 2N or diploid, and these right here only have 23 singles, right? And that is said to be N or haploid. It's how they refer to that, see? And these, this extra step is called, I was taught division, reduction. Because basically you're reducing the chromosomes in half, right? Because you are a composite of your mom and your dad, right? You got half your genes from mom and you got half your genes from dad, right? So that's why we need this other situation. Meiosis. M-E-I-O-S-I-S, right? Now, here's the thing. We said men have like 20 to 150 million sperm each time they ejaculate, okay? So, in men, boom, 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 right? That's the way it happens. You got 4 viable gametes, sperm cells from that, okay? But how many ovum, how many eggs does it take? Don't you answer? How many ovum, how many eggs does it take to have a baby?
1.
Uno, 1, right? So, a little bit different. If this is a lady, what happens is this, right? What happens is this. You get one ovum, right, or egg, and these 3 are little bitty shriveled up ones called polar bodies, P-O-L-A-R-B-O-D-I-E-S, polar bodies, right? Because in the ladies, it only takes 1 ovum, right? Now, there's 150 million little swimmers trying to get to the one lady, but anyway, 1 ovum, see? So, in men, boom, 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 boom. Yes, 4. In ladies, you also get the 4, but these are non-viable. These are not going to work, right? Because you only need 1. If you have 2 ovums, they get fertilized. What do you get? 2 babies. 3? I got a patient. She got 3 at the same time, right? Your brother went to school with some of them, but anyway, they were older a little bit. But anyway, okay? So, there we go. So this is meiosis. So what I need you to know is, you should know meiosis, you should know meiosis, right? Mitosis. And you should know that meiosis is for gametes or sex cells. And there's an extra step called division reduction, right? And it is a way to cut the amount of chromosomes in half. So we only have the 23 singles, right? And so, again, if you're full, if it's proper amount, it's going to be diploid, 2N, 23 pairs, 46 chromosomes. But when you're talking about gametes, you're talking about N or haploid, and that is 23 singles, okay? Haploid, right? Haploid, okay? There we go. Yes? Any questions about this? It's more complicated than that, but this is a general class, and if you get a genetics degree or something, you should study this more in detail. But for you guys, this is the base level. This is so you get it, so you can talk to that person sitting next to you on the plane. Oh yeah, I know exactly. Yeah, what you're talking about. Yes. Huh? Yeah, very important. You remember a couple of key words, so that way you throw those words in, and they think you know more than you know, right? Yeah. Fool them every time. Then you go, oh, I'm really sleepy. I think. Right? Yes. But anyway, yeah. Right? I tell you, two, been in practice 36 years. I've had some funny things happen, and one guy told me, he said, I have a rash on my scrotum. And I'm like, oh, you probably need to go to the dermatologist because I don't treat rashes and this and that, right? But he said scrotum instead of scrotum, right? So after he left and this and that, I went in the back room and laughed, right? After he was gone out of the building, but not before. You don't ever, ever, ever want to do anything to embarrass a patient. You need to remember that. You don't ever want to say or do anything that will embarrass a patient. But anyway, right? Okay, so again, you need to know what mitosis is. You need to know what meiosis is, the extra step, division reduction. Diploid 2N, how many chromosomes is that? 46, right? 23 pairs. And N, haploid, how many is that? 23, right? Singles, right? And when you're talking N haploid, you're talking sex cells, ovum or sperm, right? Got it? Get some more of it. Yes? Hi. Okay. All right. Now, let's go ahead and let me take a break for just a minute, and then we will do the we'll cut the kidneys. We'll do the kidney lab. Okay.